So our next talk is by Dr. Devendra Venkatramani. He'll be talking on FRCS Glasgow, when to start and how to excel. Sir has done his fellowship in vitreoretina from LVPI Hyderabad. Subsequently, he has also done his FRCS Glasgow and MRCS Edinburgh. Currently, he is working as a consultant retina specialist at Lakshmi Eye Hospital and Institute at Panvel.
Thanks, Dr. Pranita. We've actually been privileged to have this instruction course for the last 6 years in AIOS. And it's always a learning for us because we keep learning something new about the topics that we are supposed to be experts in. So just to give you a brief overview, the Royal Colleges are established in the UK and have been around for, in some cases, more than 500 years. So these are really colleges or centers of training and learning which have a very rich history, and it's probably something like this that attracts us to give these examinations, to be part of something with such a grand tradition that makes us interested in giving these examinations. I'll be focusing on the FRCS Glasgow. Basically, it's a degree examination that is held by the Royal College of Physicians and Surgeons of Glasgow. And these are a few images of the city of Glasgow where we had visited after clearing the examination for the convocation ceremony. This is a little treat you can promise yourself to do at the end of the examination to treat yourself. That's a deep-fried Mars bar, incidentally. Glasgow is the heart attack capital of Europe, in fact, because they have a lot of deep-fried food. A quick tip, this is my friend and colleague, Dr. Asif Virani. We studied for the examination together and we made a pact that if we should clear it, we would go for the convocation together. It's very useful to have somebody you can study with, because it really makes life a lot easier. And these are some of the glimpses of the very glittering convocation ceremony. So the examination is basically in 3 parts. The format has changed in the last few years since the COVID epidemic. The first part is basic sciences and optics. It's a 160 MCQ paper, which is 2 hours long. The second part now does away with the original long answer question format. Now it's only MCQs of 180 in number, and you have 2.5 hours to fill up those MCQs. There are no long answer or essay questions as there used to be in the past. Part 3 is still in 2 forms. Can we do that later? Part 3 is in 2 forms. There's a structured oral examination, which is nothing but a viva, which has OSCEs with it. And it covers 3 differing regions of the eye, which is lid, oculoplastics, and anterior segment. Posterior segment as a separate viva, and neurology, motility, and general medicine as a third. And the clinical examination, where you would be invited to see patients, is again divided into 4 different stations where you see different patients related to that specialty. The top point to note is that those sections of ophthalmology which we were very happy to leave as option, as it is called in the Indian examinations, whether it was neuro-ophthalmology or oculoplasty, you cannot afford to do that, because there are individual stations here and you need to pass every station to be awarded the degree. So you cannot leave for option, for example, oculoplasty or neuro-ophthalmology, because you have to pass in that separately. The eligibility has also been simplified in terms of its language. Now, basically, you need to have your primary qualification that needs to be recognized by the GMC in the UK. MBBS in India is recognized, followed by your 1 year of internship, followed by 1 year clinical experience in any field. So if you have done a clinical posts of a year or an observership of a year in any field which is not ophthalmology, you can still appear for part 1. But when you get to part 2, you should have completed 5 years of post-qualification training. At least 54 months should be in clinical ophthalmology. So unfortunately, a research ophthalmology fellowship cannot be shown as part of this 54 months. And to appear for part 3, you need to basically have completed parts 1 and 2. There are exemptions, as Dr. Pranita mentioned. You are exempt from part 1 if you've completed the ICO examination part 1, etc. So you can go through those and you don't need to replicate and duplicate your efforts to appear for all of these parts. The fees are a bit of a headache. So whereas ICO added up to 1.5 lakh rupees, this crosses 2 lakh rupees. The fees increase by at least 10% every year. The pound had depreciated a lot during the COVID time and during Brexit, but unfortunately it's bounced back up, unfortunately for us Indians. So look forward to shelling out a lot of money to clear this headache. That's a separate headache you need to think about. The exam very happily says you have a maximum of 6 attempts for each part, but I think all of us would be, most of us would be seriously considering a third or a fourth attempt, because we would be quite aged and infirm. The examinations are held at very wide intervals, and you may or may not get an option to write it because there are long waiting lists. So unfortunately, you may not get an opportunity, although you are well prepared and you've even filled the form and paid the money. This is the website of the college, so all your questions will be answered, and even questions you didn't think you didn't think of would be answered on this website. A brief idea about the examination is it's not testing so much the depth of your knowledge, but also the breadth of your knowledge, and it's comparing your answers or your score to the number of people who got a similar score. For example, in Indian examinations, we have a cutoff percentage. If you score 50%, you've passed the examination. 95% of the people appearing for the examination may score 50% and clear the examination. However, in these examinations, it's not that. You are compared to your peers who are appearing for that examination. So you need to clear the percentile. For example, in this situation, you can see the pass mark was a very odd figure of 62.21%. Which means that it's not a preset cutoff. It varies depending on whether the exam is deemed to be difficult or whether the exam is deemed to be easy. If it's difficult, the pass mark is lowered, and if it's an easy exam, the pass mark is raised. Preparation for the exam is already been covered beautifully by Dr. Pranita. I would just recommend exactly the same. These are the textbooks. You can all access them. Most of them are the foreign textbooks are even available in PDF format, so you can go through those. And emergency medicine is specifically tested, so I would strongly recommend brushing up your already lost, forgotten knowledge of cardiac arrhythmias and ECG reading, because these are important aspects of the examination, simply because you need to be able to assess the situation, establish a preliminary diagnosis, and initiate measures to stabilize the patient's condition in the form of a medical emergency. A few tips is that when you're preparing for this exam, be very practical, because you're not going to be asked what is the percentage of a particular complication, or what is this specific prevalence of a particular disease, but you need to know which diseases are more prevalent, and those should reflect in your answers, both in the theory and in the vivas. So generally, the schema follows from a life-threatening condition. When you're answering, you give out the life-threatening condition first, followed by something that's vision-threatening, and something of least importance would be a cosmetic indication. So the viva specifically, as I mentioned earlier, is 3 stations, which are 20 minutes each, and you're asked structured examinations. There's not much scope for the examiner to ask you anything at the top of his hat. He would have to follow a scripted format of the question and answer. If you hit those keywords, he would be happy and give you marks. If you unfortunately are not able to hit those keywords, he has a little bit of a leeway to give you some help, but you need to really be able to answer what is on his model answer sheet before you can be awarded those points. The clinical examination, as I mentioned, covers these 4 stations, and you get about 12 minutes at each station. On an average, you may be able to examine 3 or 4 patients. Generally, if you're doing well, the examiner would ask you to shift over to the next station. There are certain practical aspects, and you really need to prepare for the clinical examination, because it's totally unlike anything that we've done in our DNB practical or MS practical. Practice does pay. Keep practicing how you would answer in a viva, and this is where I would reiterate having a friend who's also giving the examination with you, and you can play off each other's answers and try to help each other give better answers. Some of the tangible benefits of clearing the FRCS Glasgow is you do not then need to give the PLAB to avail for GMC registration. If you don't have the FRCS, you would need to sit for the PLAB. There are changes, and there are yearly changes because of Brexit and other political decisions. So these may not be accepted as valid degrees in all different countries. So I would strongly suggest you know what are the licensing degrees before you embark on this journey. As I mentioned earlier, there are cross exemptions with different examinations which would be helpful for you. Many people just want to give examinations. They like the adrenaline high. So if that is really something that sails your boat, you would probably enjoy giving these examinations. And of course, you can add to the long tail of post-nominal initials, as some of our previous speakers have shown you. You probably don't need to go to this extent, but you could always be a little proud of a tail that is a little shorter than this, maybe. So there are some important disadvantages or caveats which I would like you to understand, that it's not, the FRCS Glasgow is not a licensing examination. You still have to go through the country's licensing examination and formalities. And of course, it's a fairly expensive examination, so plan in advance. So at Lakshmi Eye Hospital and Institute, we've been running this refresher course, which is directed mainly towards the practical aspects of the examination, the viva and the clinical aspects. Dr. Ashwin Gandhi is the brain behind it, and he's a regular faculty. And we also are privileged to have faculty members who are examiners for the examination. So you would really learn from a very practical point of view as to how you should appear for this. You could get in touch if you're interested. This course was discontinued over during the pandemic, but we are reinitiating it this year. So thank you, and anybody who's giving the examination, wish you all the very best.
So any questions or comments from the audience? Yes, Manu.
Yeah, it's not a question, just a couple of things that when I gave the exam a few years ago, if you don't have a good station, that you should not get disappointed that the entire exam has gone, because I think the clinical stations, I think, have more weightage compared to the OSCEs. So if you do well in your clinical stations, even if your OSCEs have not gone too well, which was the case with me, I think you can cover up there. So that is something we have to keep your morale high throughout the exam. Because I said it's a whirlwind exam. You just go from here to there, here to there. It's very easy to get disappointed. So keep your this thing there. And secondly, even if you've done DO, but if you've done FRCS Glasgow, the Maharashtra Medical Council gives you an option of registering it as your additional qualification. So a lot of hospitals which do not take diploma candidates for a particular job, but if you have FRCS Glasgow or any such things, you will be able to get a job there because of the FRCS, and you can register that for additional qualification. And number 3, practice practice, the mode of examination, how you speaking with your peers around you is extremely, extremely important. Crucial.
Yeah, so basically it's, as Devendra mentioned, it's not an exit exam. So there are topics which are no-goes, as you mentioned, Maya, but there are topics where if you have done poorly, but they are topics you are not considered of as a basic topics, you'll be able to easily compensate in other parts. But if, let's say, if you couldn't pick up RAPD, which is a very critical part of managing a case, then there is a likelihood that even if you have done very well, you probably may not go through. So that they have those barriers, as you very rightly said. The second part about the Middle East, it's very dynamic, and now I think these initials, they really don't give a lot of weightage. They require you to have an experience in other countries, not just the degree.
Yeah, so please go ahead. We have one more question. While you get to the mic, just to say that the exam pattern, the philosophy behind it, the method of marking is totally different. So just as Maya pointed out, there's something called there's a pass, there's a strong pass, and there's a weak fail. So you can compensate. This is a little bit of behind the scenes information. You can compensate a weak fail with a strong pass, so they can sort of moderate your result. But if you've done something, made a single gross error, which may, in practice jeopardize the life of a patient, then that's a strong fail and you may not recover from that. Please go ahead.
What's the opportunity in UK?
Sorry, extra advantage?
In UK?
In UK.
What advantages FRCS gives in UK?
See, if you register for the if you have cleared your FRCS, that gives you an opportunity to register in the NHS website where you get a GMC registration. And if you're able to clear through the GMC registration, which also requires additional things like how many procedures, your log records of all your procedures that you have done, surgeries. And with that, if you're able to get through your GMC registration, you can go abroad and even practice there through the NHS structured, practice platform.
It basically, you don't have to write PLAB to register with GMC. It allows you to register with GMC with the added caveats.
things.
Yeah.
So remember that PLAB will test you from first year anatomy, physiology, biochemistry, general surgery, everything, your entire MBBS portion. So if you can skip writing an examination on that, I think you should be very happy if you can get away by just doing an ophthalmology examination.